Well, doctors in Delta State want government at all levels to provide adequate security and better welfare packages for all health workers in the country to enable them render quality service and avoid the massive brain drain. The doctors who spoke under the aegis of Medical and Dental Consultants Association of Nigeria, Federal Medical Center Asaba, were holding their biennial general meeting. They want government to sustain the gains made during the COVID-19 pandemic to improve healthcare delivery to overcome future outbreak of diseases. Iken Amechi attended the meeting and now reports.
Due to the essential services they provide, health workers are more vulnerable to the rising insecurity in the country. Banditry and insurgency in the north and kidnapping and armed robbery across several states have put these caregivers on the receiving end. In some cases, they have paid with their lives. Even so, they cannot be said to be enjoying the best working conditions. At this conference for the third biannual general meeting of the Medical and Dental Consultants Association of Nigeria, speaker after speaker called for urgent action to help those on the front lines.
Insecurity affects output of the health workers, and this may be responsible for some of our colleagues running away from Nigeria to go and practice outside the country.
And I can see that they are a valuable partner in nation building. So any government who is serious about making sure that this country moves forward, they must look after the health sector. Without health, you can have the billions in the world. You can't do anything.
The COVID-19 pandemic exposed missing links in the Nigerian health sector, but it also showed the resilience of health workers who want the gains made from managing the coronavirus to be sustained.
Despite the fact that we lost colleagues, we lost dear ones, we lost Nigerians who we could not save, that succumbed to COVID-19 and all of that. But I think going forward, there's been a positive response from the government.
In terms of infrastructure, it's still far away. And in terms of leaders, and we are talking of political leaders, we don't know whether they have actually learned a critical lesson.
We receive 5,000 naira per month for hazard allowance. With the emergence of COVID pandemic, we dialogue with government. We thought we could use the opportunity to enhance this hazard allowance. Government responded, but it was a very transient drop. They paid the special hazard allowance for just 3 months and stopped.
Nigeria has recently been hit by a wave of deaths arising from an undisclosed illness which was eventually identified as yellow fever, but Lassa fever, Ebola fever, and now the coronavirus are some of the public health emergencies health workers have grappled with in the past few years. Iken Amechi, TVC News.